Hello, everyone. My name is Felicia Fuller, and today I will be presenting my policy analysis on suicide prevention. Suicide is a serious public health issue that affects individuals, families, schools, and communities across the United States. My policy analyst examines current suicide prevention efforts, evaluates policy alternatives, and recommends expanding school based mental health services as an effective strategy to reduce suicide risk among children and adolescents. Suicide remains one of the leading causes of deaths in the United States, particularly among adolescents and young adults. Many young people struggle with depression, anxiety, trauma, and other mental health conditions but do not receive treatment because of barriers such as cost, stigma, or limited access to providers. The purpose of this policy analysis is to examine current suicide prevention policies, evaluate alternative policy options, and recommend an evidence based solution that improves access to mental health services while reducing suicide risk. Several federal laws support suicide prevention efforts. The National Suicide Hotline Designation Act established the 988 Suicide and Crisis Lifeline, making crisis services easier to access. The Mental Health Parity and Addiction Equity Act requires many health insurance plans to provide mental health coverage comparable to physical health care. Federal agencies such as SAMHSA and the CDC work with state and local governments to fund, implement, and evaluate suicide prevention initiatives. Many stakeholders influence suicide prevention policy. Federal agencies provide funding and guidance, while schools and healthcare providers implement prevention programs. Advocacy organizations such as the American Foundation for Suicide Prevention and the National Alliance on Mental Illness educate the public and advocate for policy change. Parents and students also play an important role by supporting mental health awareness and encouraging early intervention. Suicide does not affect all populations equally. Rural communities often have fewer mental health providers, while low income families may struggle with transportation, insurance, or treatment costs. LGBTQ plus youth also experience higher rates of depression and suicide risk due to stigma and discrimination. I applied the Health in All policy framework because it recognizes that education, housing, employment, and healthcare all influence health outcomes. Policymakers must also balance protecting individual privacy while ensuring that students at immediate risk receive appropriate intervention. I evaluated two policy alternatives. The first is expanding school-based mental health services by hiring additional counselors, psychologists, and social workers while implementing suicide prevention education and routine mental health screenings. The second option is expanding telehealth mental health services, especially for rural communities with provider shortages. Although both options have strengths, school-based services offer greater opportunities for early identification and intervention because students interact with school personnel every day. Based on my analysis, expanding school-based mental health services is the strongest policy recommendation. Schools provide one of the best opportunities to identify mental health concerns before they become crisis. This policy also improves health equity by increasing access for students who might otherwise have difficulty obtaining services. Research from the CDC and SAMHSA demonstrates that connectiveness, early intervention, and supportive school environments reduce suicide risks and improve mental health outcomes. Implementation would involve collaboration among SAMHSA, state education departments, local school districts, and community mental health providers. Schools will hire additional mental health professionals, provide suicide prevention training, and establish referral systems. Success will be measured by tracking counselor staffing levels, student screenings, referrals for treatment, suicide attempts, and student well-being over time. In conclusion, suicide prevention requires collaboration among healthcare providers, schools, families, and policymakers. Expanding school-based mental health services is an evidence-based strategy that improves access to care, promotes health equality, and supports early intervention. By investing in prevention today, we can reduce suicide risks and improve the health and well-being of future generations. Thank you for your time.